The following presentation is all about the importance of vaccinating our patients and what we can do as nurses to educate our patients. Why should our patients get vaccinated? There are several reasons why. So the biggest reason is to protect from infectious disease. It also decreases hospitalizations related to infectious disease that can be prevented with a vaccination. Also, vaccinating children. Many young children can't get vaccinated because they're too young to get vaccinated. So vaccinating young children, protecting infants, and then also promoting herd immunity, which is becoming immune to infectious disease as a community. In the previous slide talking about herd immunity, when we vaccinate most of our patients, the other patients that are not vaccinated can still be protected since we're vaccinating most of the population. And one of the statistics on the CDC website was in 1921, diphtheria had over 15,000 Americans die that year from the disease. But since the vaccine, between 2004 and 2014, only 2 cases of diphtheria were found. The next part of our presentation will be focused on pediatric immunizations. Healthy People 2020 as a first objective as nurses is to achieve and maintain effective vaccination coverage levels for universally recommended vaccines among young children, which is the pediatric population. Our goal is to decrease the percentage of children who receive 0 doses by age 19 to 35 months, and in 2015, only 0.8% of children did not receive vaccinations. We should also educate parents on following their individual child's vaccination schedule, explaining the schedule and risk factors associated with each age group, explaining why they need certain vaccines at these times. Our job as nurses with the children vaccination schedule is to continually educate ourselves on the schedule and any advances in the schedule. That way we know how to answer parents' questions and address their concerns.
The following video may be a very good resource that you might want to show to parents if they are having any concerns about the pediatric vaccination schedule.
I'm Dr. Ari Brown, and I'm talking about an important subject today, the childhood vaccination schedule. Should you ever tinker with it? In recent years, vaccines have been a hot topic and have left some parents wondering whether it's safe to give so many shots at the same time and to give them so early in life. As an official spokesperson for the American Academy of Pediatrics, which represents 60,000 pediatricians, I can say that the answer is definitely yes. Why are kids getting so many more shots than we did as kids? Because vaccines work, and modern medicine has been successful in creating more of them. They prevent horrible, serious infections, diseases you do not want your child to have. Thank goodness there are so many shots. Today, vaccines that were not available when I was a child protect against 3 different types of bacterial meningitis, a potentially fatal brain infection. And even though the total number of shots has gone up, a child's immune system actually has less work to do to mount a protective response because of the way newer vaccines are made. Today's vaccines are smarter and safer, and our children are getting better protection than we ever got as kids. Vaccines are researched for an average of 15 years before being approved for use, and new vaccines are always given with other existing vaccines as part of the testing process. The Centers for Disease Control and Prevention then recommends a vaccination schedule, working with top doctors and infectious disease researchers to make that decision. In short, the schedule is thoroughly tested and studied. A child receives a vaccine as early as it will be safe and effective, such as the hepatitis B vaccine shortly after birth, the whooping cough vaccine at 2 months of age, and the measles vaccine at a year of age. The diseases that vaccines protect against are often the most severe in infants and young children. That's why the timing is so important and why a staggered or delayed vaccine schedule is a dangerous idea. Giving several shots at once does not damage, weaken, or overload the immune system. Vaccines boost the immune system. There is no research that shows that delaying certain shots is safer. In fact, a 2010 study showed that there is no difference in development in children who have received their shots on time compared to those who were unvaccinated or late to get their shots. As a pediatrician and as a parent myself, I can tell you that I vaccinated my own children with the recommended vaccination schedule, and I wouldn't do anything differently for your child.
For newborn vaccinations, if an expecting mother is not vaccinated, we should educate her on the importance of receiving safe vaccines during pregnancy, as well as vaccines that may not be safe during pregnancy to be given after delivery of the newborn in order to protect their newborn. Also, the Healthy People 2020 site wanted a goal to meet target of 85% of Hep B vaccination effective coverage level for the first dose of Hep B within 3 days of birth. And in 2010 and 2012, it was 70.6%. So as nurses, we need to educate our patients more in order to improve vaccination compliance. A specific pediatric population that needs to be vaccinated is children that have chronic kidney disease. The Nephrology Nursing Journal came up with a quality improvement system and really looked at the barriers of why these children were not being vaccinated. And one of the biggest barriers was the circulating myths on vaccinations by the parents. So they educated the parents and vaccine rates went up significantly. What can we do as nurses to increase the pediatric vaccine rates among this population? We can provide handouts to the parents to address any concerns that they may have, and also refer them to the CDC website, which is a great credible source with tons of vaccination information. Our role as nurses is to educate parents on the non-existent link between autism development and vaccination administration. A 5-year research study was done on infant monkeys, testing their neurodevelopment after thimerosal vaccinations were administered. A test group had saline injections, and the two groups were compared. They looked at their learning, social behavior, newborn reflexes, and their interactions with the other infant monkeys. And the conclusion was that there was no abnormal behavior overall that would show a significant link between neuroinvolvement, which could be autism, and vaccinations. As nurses, we should also check the chart to see if they are due for their next vaccination. If they are due but are medically unable to receive vaccinations or parent refusal, take standard precautions in order to prevent the spread of infection. And also educate the parents that they are at an increased risk for developing infection due to not being vaccinated.
One of the objectives of Healthy People 2020 is to increase the routine vaccination coverage levels amongst adolescents. This portion of our presentation will focus on our role as nurses and how we can help to meet this objective. It is recommended that teenagers by the age of 13 to 15 years receive the following vaccinations: 1 dose of the Tdap booster, 2 doses of varicella, except for children who have had varicella, 1 dose of the meningococcal vaccination, and 3 doses of HPV, and this is recommended for both males and females. There are many misconceptions surrounding the HPV vaccination. Because of this, it may be a good idea to provide a resource such as the following video to any parents that would like more information regarding the vaccination.
Most parents today have heard about the HPV or human papillomavirus vaccine, but don't know that much about it. And if you don't know much about it, how can you decide if it's right for your son or daughter? Here's what you need to know. HPV is the most common sexually transmitted infection in the US. HPV are a group of over 200 related viruses, and while most of them aren't harmful, there are about a dozen so-called high-risk HPVs which can cause cancer. Almost all cases of cervical cancer and about 95% of anal cancers are caused by HPV. The strains that cause genital warts do not cause cancer, but importantly, the strains that are covered by the vaccine are the cancer-causing ones. Most sexually active adults in their 20s have been exposed to HPV, but for most, the infections clear up without causing harm. In other cases, chronic infections of certain types of HPV can cause cancers of the cervix, vulva, vagina, penis, anus, or throat. The Food and Drug Administration has approved 2 HPV vaccines. They are safe and effective. The HPV vaccine protects females and males from HPV diseases. All girls and boys starting at age 11 or 12 should get 2 or 3 doses of the vaccine. If you're older than the recommended age, talk to your doctor about whether or not you should get the vaccine. If you haven't had the vaccine, the best way to prevent infection is to use barrier protection such as condoms.
As nurses, it is very important to educate parents and teenagers on the Tdap vaccine and the varicella vaccine. The DTaP vaccine that infants receive when they're younger will begin to wear off during adolescence. Therefore, it is important to educate parents on the importance of getting the Tdap booster shot because of the ability for the DTaP vaccine to wear off. Without the booster, they will not be protected from tetanus, diphtheria, and pertussis. The vaccination for varicella is typically given before age 13 because the disease is very highly contagious. If the vaccination is not given by the age of 13, we should educate our patients that the teen should receive 2 doses at least 28 days apart from each other in order to be protected from varicella. The meningococcal vaccination is also very important for adolescents. This type of vaccination protects from blood infections and meningitis, which is a potentially fatal disease. All adolescents between ages 11 and 12 should receive at least 1 dose of the meningococcal vaccination. It is important for us as nurses to educate parents and the adolescents that around age 16, the risk for this infection increases. So if they are unvaccinated by 16, they will need to get a second dose of the vaccination. The Healthy People 2020 target was 80% coverage, and this target was met in 2015. Therefore, it is very important for us to continue to teach our patients to receive this vaccination so that we maintain this coverage. One of the most common misconceptions about the HPV vaccination is that only females should receive it. This is very untrue, and both males and females should receive all 3 doses of the vaccination. The Healthy People 2020 target is that 80% of males in this age group receive all 3 doses of the vaccination. As of 2015, only 27.1% received all 3 doses. This is less than half the population of adolescent males being protected. Therefore, it is very important for us as nurses to teach all of our patients that both males and females should receive the HPV vaccination. That way we can help to increase the amount of males receiving the vaccination and help get to the 2020 goal. Along with the Healthy People 2020 target of 80% of males in the age group receiving 3 doses of the HPV vaccine, Healthy People 2020 would also has a target that 80% of females in this age group will receive 3 doses of the HPV vaccine. As of 2015, only 37% of females had 3 doses of the vaccination. Again, this is less than half of the females being vaccinated. Our number one role as nurses, being in contact with patients the most, is education. We need to educate the female adolescents as well as their parents about the importance of the HPV vaccination. In a recent national study that was done to determine the reasons for non-vaccination in females with the HPV vaccination, it was concluded that the top 3 reasons for non-vaccination reported by the females' mothers in the sample were that there were concerns about vaccination side effects, there was a fear that the vaccine could be dangerous to their daughter, and there was provider non-recommendation. So the big question here is, what can we do as nurses? One thing that we can do is we can talk with the parents and the adolescent about the possible side effects of the vaccination, and we can discuss any concerns that they may have. Another thing we can do is we can explore the possible fears that the parents may be having about the vaccine. We can also show research to the parents to debunk the fears that they may be having. The third thing that we can do is talk to the adolescent patients and the parents about the HPV vaccine and all other vaccinations recommended for age group. This would solve the problem of provider non-recommendation. If something isn't recommended, then there's no way for some parents and patients to know about the vaccine. Therefore, if it's recommended, there's a higher chance of them receiving that vaccination.
The following portion of the presentation focuses on immunizations in adult populations. Pediatric vaccination is routinely emphasized in communities and with community outreach programs. However, adult vaccinations play just as important a role in community health. Adult illness preventable by vaccinations is actually more prevalent than pediatric preventable illness. This can be explained by the numerous interventions that communities have introduced to improve pediatric vaccination. However, strategies for adult vaccinations are lacking. New strategies need to be developed to improve vaccination coverage for adult populations. The Office of Disease Prevention and Health Promotion have outlined in their website, Healthy People 2020, 3 goals for improving adult immunization coverage. Current trends, as indicated by Healthy People 2020, show that adult vaccination rates fall below the intended goals. For adult pneumococcal vaccination, the current rate is 60% as of 2008, with a goal of 90%. For adult herpes zoster vaccination, the current rate is just 6.7%, with a goal of 30%. And for adult influenza vaccinations, for older non-institutionalized patients, the current rate is 66.6%, with a target goal of 90%. To increase compliance rates for vaccination in adult populations, numerous methods have been identified to improve overall compliance and vaccination coverage. Education of potential vaccine recipients and publicity to promote vaccination are important. In addition, increased access to vaccination services are needed to improve overall compliance. Increased emphasis in healthcare teams on 100% population vaccine compliance is necessary among healthcare teams and providers. And finally, use of practices that improve vaccination coverage using technology, computer tracking, improved outreach, and culturally appropriate education and screening tools are needed to improve adult vaccination. Using guidelines generated by recent research, the Los Angeles Department of Health and Human Services institutionalized a number of improvements to their adult vaccine compliance programs, including using automated computer algorithms to flag charts of clients eligible for vaccination. Additionally, they used automated reminder phone calls to contact clients who are eligible for adult vaccinations. Finally, they provided a systematic screening tool to be implemented at every visit to identify those that are at need for the pneumococcal vaccine, providing culturally appropriate interventions and language. In addition to all of these external interventions aimed at improving adult vaccination rates, the research indicates that the primary motivating factor in getting more adults to get vaccinated is contact with healthcare providers and teams. This says that it is important as our role to never miss the opportunity to vaccinate those in the target population. By using the technology to flag the charts for vaccination, by providing continued education for adult populations at risk, and by encouraging clients to receive vaccinations at regular schedules, the healthcare providing team plays a key role in ensuring that all adults receive the scheduled vaccinations and to prevent illness.
In order to promote adults receiving the vaccinations that are suggested, it is important to provide resources such as the CDC website's vaccination quiz that is talked about in the following video.
Most adults, and especially those who have kids, know the importance of getting children properly vaccinated. But did you know there's a good chance you might need some vaccines too?
Adults really aren't aware of which vaccines that they need. Most people are aware of influenza vaccine, but when it comes to most of the other vaccines, they really are not aware that they need vaccines too, just like kids do.
There are several reasons adults might need vaccines.
First, like flu vaccine, you need to get a flu shot every year. Some vaccines you need a booster, like the tetanus vaccine. That one you should get one every 10 years. And other vaccines you may need as an adult because you missed them as a child or they weren't offered when you were a child, or because you've developed some medical condition.
To take some of the guesswork out of adult vaccines, the CDC has developed a vaccine quiz which is on their website to help narrow down who needs what when.
You can go on there, enter some information, your age, for example, and other things, and it'll give you a list of vaccines that you might need. And then you can take that and talk with your provider about those vaccines.
But what if you don't know which vaccines you've had?
There are a couple of different ways. If you're not sure you've had a vaccine and you can't get your records, talk to your provider. And in general, the rule is that you should go ahead and get the vaccine. For some vaccines, you can have a blood test, and you can talk with your provider about that, and it can tell you if you already have protection.
One exception to the rule of always getting the vaccine applies to people with a weakened immune system and live vaccines.
That's the MMR vaccine, which prevents against measles, mumps, and rubella, and then the varicella vaccine, which prevents chickenpox, and the zoster vaccine, which prevents shingles. But if you have a very weak immune system, you do want to get many of the inactivated vaccines, again, like the flu vaccine or pneumococcal vaccine.
In the end, vaccine schedules should be individualized, depending on a person's age and their medical conditions. But with all your medical needs, talk it over with your healthcare provider to make sure you're getting what you need when you need it. For Accent Health, I'm Adam McCoy.
In order to meet the outlined goals from Healthy People 2020 regarding adult vaccinations, many novel approaches need to be considered. While there have been noted improvements in some vaccine coverage, such as herpes zoster, which has met its stated goal of 30% coverage, other adult vaccinations continue to lag behind, specifically pneumococcal and influenza. Healthcare teams must be vigilant in monitoring all clients, and do not miss the opportunity to vaccinate clients when they're there. Improved community outreach and improved tracking may be key to meeting Healthy People 2020 goals. Finally, client education and encouragement may be the most important factor to getting more people vaccinated and stopping the spread of preventable disease.